Hello, I'm Dr. Rudy Cashman. I'm a neurosurgeon in Fort Wayne, Indiana. I've been in the field of neurosurgery for 40 years, but I'm only 39 years old. But tell you, I've developed an interest, of course, in healthcare reform. We're going to, end of this year, probably be given a program by the government as to what their ideas are. And they've allowed people across the country to express their thoughts in the matter. And I think since I've been in the business 40 years, my words, I think, should be worth something. And I've developed some very clear thoughts, and I'd like to share them with you. So let's start with healthcare reform. And this is to inform doctors, congressmen, senators, mayors, whatever, physicians, as to what my ideas on this matter are, and hopefully could debate it with me or join me in my venture. Let's face it, the saber-toothed tiger is running at us. The reality and stress of health coverage for everyone is running straight at us. It's necessary. 50 million people without insurance. People are so nervous they may develop a chronic illness and have nothing to pay for it. And it's time has come. This is the right time that we finally need to do something about it. We're behind in the world on healthcare reform, and I think this is the year. So I'd like to give my input into it. What should we as citizens do if we wish to participate? What is possible? What is realistically achievable in my estimation? I say Medicare for all. I've never had a Medicare patient that doesn't seem possible. In 40 years that I can remember that they complained about having Medicare. There's some inconveniences. There's occasionally somebody has a problem with a bill, doesn't understand it, one thing or another. We certainly see that. But the basic system, I've never had a serious complaint. The other day I talked to an ENT doctor where I was having coffee with someone. He said, is that your experience, John? And Dr. Thomas said, I've not heard any serious complaint in my 40 years either. He just retired. But I'm still actively practicing. Isn't that interesting? So it is an existing system that works. Why not take advantage of that? Otherwise, we'll start with a whole bunch of fragmented programs and we still not have everyone covered. This is something that works, and the bureaucracy is already set in there, and we could go across the system and ensure everyone. And I'll tell you a little bit about the advantages. What would be the advantages of such a system? There would be disadvantages, and I'll discuss them openly. Everyone would be covered with insurance. Well, that's a good thing. That obviously is a good thing. The biggest advantage, employers can compete better in the U.S. in world economic markets. Health insurance is no longer on the back. We can be better competitors in the world. More jobs. I think employers would be very happy with this. We have choice of doctors in hospitals in Medicare. Isn't this excellent? Choice of doctors and hospitals in medicine. Go anywhere you want to in this country, and sometimes even out of the country. Medicare will cover some things that can't be covered in this country. So it's a wonderful system. Something else I would do, I'd cover the veterans. Why not cover the veterans? Veterans should be covered. They could use local hospitals, any doctor or hospital of their choice in the country. They deserve it. For Pete's sake, they put their life on the line, go somewhere else, and we make them go to one hospital system. Give them a choice. I say they could choose the VA, they could choose the local hospital, they could go to a huge medical center. It is their choice. It'd be more convenient for them. In the long run, would save money. For example, there always will be some VA hospitals, the specialized hospitals, but some veterans hospitals would be closed. It would save a lot of money. I'm not saying it should be closed because they're bad. There'd be some other hospitals would be closed through competition. Give the veteran the choice. He can go to a local doctor. He doesn't have to go to Chicago or somewhere else to see a physician. So I think there'd be a wonderful benefit for them. Medicare has less insurance, has less overhead than insurance companies. Medicare overhead, I've heard, is around 6%. Insurance companies' overhead, around 20%. A huge savings. Most Medicare patients are satisfied customers. That's important. If I can go 40 years and hardly anybody complains, I mean, that's hugely important. If I heard complaints about insurance companies, I couldn't count them. I couldn't count that high. I don't think I could count that high, the number of complaints about insurance companies, including physicians. We can't predict what they're going to pay and when they're going to pay, and we don't know when they're going to appeal. We don't know when they're going to turn their phone call. It's a very complex system. Once everyone is, let's look at more advantages. Once everyone is covered with Medicare, basic health care reform could be carried out. No question we need some health care reform. After 40 years of watching this, our medical system, I think could be improved. How could it be improved? For example, we should have an orientation towards wellness. There's no question, I admit it. I'm a full-time neurosurgeon, but I'm a wellness doctor. No question about it. I went to yoga studios. I have a diet class going at my hospital now of 200 people in it, and I'm a neurosurgeon. My yoga instructors teach it. I mean, it's marvelous. The last class of 100 that we had, 7 people lost their diabetes. My God, look at the savings to the government, and look at the better health and trouble I saved those people. They're not going to get heart disease. They're not going to get strokes. I have some people that lost 22 pounds of weight. One patient lost 100 pounds of weight. So medical care today is not oriented towards wellness. I went down to IU, my 45th medical school reunion at age 39. I know that's possible. But there were 3 med students here, and the dean says, any questions? So I wrote down, what percent of time were you toward wellness and proper nutrition? The little girl who'd been a beautiful girl, had been a doctor maybe a week, said, well, geez, I remember a little bit of my sophomore year, but that's all I can remember. And the 2 other girls agreed. I hate to say this, medical school, that's pathetic. It's pathetic. 80% of the people see a doctor need a coach. They need a coach. Doctors graduating today are not trained in coaching. That is sad. So we need a reorientation the way medical care is given. We have a procedure-orientated thing, and I'm a surgeon. Why would I admit such a thing? But to be honest with you, they're willing to pay, $150,000 for a back operation, but they won't pay $200 for a year membership to my yoga studio. Does that make sense? That doesn't make sense. I could prevent a high number of operations, and the same with vascular disease and heart operations. The teaching of diet and exercise and yoga type activity. We could save lots of money, a lot of operations, but these people don't pay for wellness. It's sad. We need a reorientation, clearly, in medicine. Disadvantage. It doesn't pay healthcare providers very much. That's a problem. We don't pay family doctors enough. We should double what we pay them. We should double, because they need to be our wellness coaches. But if we're going to pay them double, we got to teach them to be wellness doctors. I think there should be a hook there. The hook should be they got to turn out to be wellness doctors. They can't just say, oh, you get a backache, off to the specialist. They're going to have to instruct the patient in exercise and weight loss and do wellness teaching. Cost relatively unknown. I admit that. If you had a program like this, the cost, I could know for certain what the estimate, but estimates could be given. There'll be increase in government control of healthcare, although it's already the big gorilla. I mean, that's the point. Doctors very well might say, it's government medicine. I mean, I can imagine that some of these channels are going to come on and say it's government medicine. But to be honest with you, it's already government medicine. Government is the 800-pound gorilla already. What does the healthcare insurance companies pay? They pay us based on Medicare rates, for Pete's sake, and some even less. So the government is already in control. I think to argue about that all day isn't going to do any good. And besides, we could create healthcare commissions and things like that could determine what the healthcare should be. That could be arranged in a manner that government is not the only controlling individual here. How to pay for it? This is the interesting part. And there could be some controversy here, but I really would like your opinion about it. You're welcome to email me about it at rudycashman@Yahoo, or send me a letter, whatever. This is my thought, and I think this is a way of paying for it. I would create a mini health surcharge. I don't like the word tax. You're not going to use the word tax. A mini health surcharge. Now explain to you what it means. The MHS is not a tax. What's the hook? What's the hook? What's the benefit to me if we had such a thing? The hook is you now have a health care card. You are covered. I have health care. I am covered. The whole country is covered with the deductibles. That's the hook. Now, where are you going to put this mini health surcharge, the MHS? You're going to apply the MHS on all unhealthy food. Interesting. Interesting. We already pay alcohol tax. We already pay tobacco tax. I don't want to call it a tax, though. It's going to be the mini health surcharge. I don't want to call it a tax. I don't think they need to be very high, maybe 10% or so. It would raise trillions of dollars. The MHS could be on hundreds of bad foods. We know what they are. The precedent, alcohol and cigarettes. People who eat the right food, healthy food, orientated to the healthy way of eating, would almost pay no tax. Won't pay the mini HS. Won't need to pay it. So we're not telling you what to eat. You eat the right food, you will not pay any of the fee. You eat the bad food, and that's what leads to heart disease, strokes, and diabetes. You're going to pay a little something. I doubt it'd be 10% added to the price of whatever it is. You go eat a big old steak, you're going to pay an extra 50 cents or a buck or something. We won't even notice it. We won't even notice the darn thing. Look at this. Illegal immigrants would pay some of the MHS. Now they get free treatment. The emergency room, we treat them free. They have no insurance. They'd be paying something. Uninsured, who we all pay their benefit when maybe some could afford the insurance and some who don't. If they eat the bad food that lead to diseases, they're going to pay some of the MHS. It won't be very high. Very interesting. It will raise a lot of money. Advantage, everyone would have health insurance. This will lead to healthier lifestyle. Some people are going to change the way they eat, and they'll be a lot healthier and happier. That certainly is a good thing. We're going to double our diabetics if we don't change something. This will help change that to be a national thing. It'll be induced partly by what you got to pay, and lead to healthier lifestyles, less sickness and disease. I mean, that certainly is a good goal. And let's talk about a little bit about Western illnesses. How did this ever happen? Let's discuss this a little bit. We lead the world in heart attacks. We lead the world in strokes. We lead the world in diabetes. We lead the world in cancer. We lead the world in metabolic syndrome. We lead the world in hypertension. We lead the world in adult diabetes. We lead the world in children's obesity. It's true. Maybe Sweden a little bit ahead of us in some of this, but most of it is us. It's because of our diet. The China study proved if you eat a vegetarian diet or semi-vegetarian diet like that, you don't get heart disease and strokes. For example, in Africa, in Kenya in 1950, they couldn't find an African who'd had a heart attack or stroke to teach the medical students. But when I saw them in the DC Journal as a resident in neurosurgery, I was taking out a brain hemorrhage twice a day from people with unbelievable hypertension. From unbelievable hypertension. Evolution of the Western diet. How did all this happen? Health implications for the 21st century. Changes in diet began with introduction of agriculture and animal husbandry 10,000 years ago. When we started gathering up animals, what did we do to them? They used to run on the range, have no fat on them. Now we made them fat. Guess who's eating the fat? We're eating the fat. Evolutionary time scale is too short a time, so the human genome did not adjust, never did change. Diseases of civilization have emerged. Food processing, stripping nutrients from the food and fattening animals is the bad diet that we're eating. High cholesterol, high fat, high sugar, refined sugars. There are 7 crucial nutritional characteristics of ancestral human diet that have changed. Evolution has a chance to kill off the people that are eating this diet. Number 1, glycemic load. Sugar content of food changed tremendously, increasing glycemic load. That's changed tremendously in the last few hundred years. The fatty acid composition, the amount of fats in your blood, is now 40%. While the Asians, it used to be 10%, it's going up too. But we eat 40% fat diet versus the Asians 10%. If you don't want heart disease, eat a 10% fat diet. Macronutrient composition, that's fat, protein, and carbohydrates. They're the macronutrients. Tremendous changes have occurred. We eat a lot more fat, a lot more protein than we used to. The micronutrient density is less. the neutral chemicals, 15 to 20,000 of them, are much less in what we're eating today. We're eating much less raw vegetables, beans, and fruits. The acid-base balance has changed. Animal protein is very high in acid content and puts a strain on the liver and the kidneys. The sodium-potassium ratio has tremendously changed over the years. We eat so much more sodium now because it comes in manufactured foods. We're probably eating 500% more sodium now than we did years ago. That accounts for the tremendous rates of hypertension that we're having. The fiber content decreased, lack of complex carbohydrates leading to obesity. Fiber lines our gut and prevents the absorption of a lot of our food. And like a complex carb or baked potato, you maybe absorb 60%. Versus fat, if you eat fatty food, you'll absorb 97%. Only 3% loss in metabolism. There's a difference in foods. So the evolutionary collision of our ancient genome with the nutritional qualities of recently introduced foods underlies many of the chronic diseases of Western civilization with tremendous cost in health and money. Chronic diseases that we're looking at. 64 million Americans have vascular disease. 50 million are hypertensive. 30 million have type 2 diabetes. 37 million maintain high-risk total cholesterol concentration over 240. 40 million have metabolic syndrome. 40 million have osteopenia, which leads to osteoporosis and strokes. Sample of unhealthy foods, trans fats, sugar, salt, manufactured foods, cereals, grains, high sugar, meats. Most beef is 80% fat. Fish is 40% fat. Cheese is 80% fat. Polyunsaturated fats could be taxed, not taxed. The mini health surcharge. Plant oil is 100% fat. Olive oil, a little bit's okay, but it's 100% oil. A lot of fast foods, not all. Most fast foods are very fatty. There's a huge list of invented and manufactured foods. We could probably name 200 or 300 foods. We could say 5 or 10% mini health surcharge on them, raise tremendous amount of money, and change the way that we eat. I do not agree. What don't I agree with? Probably hundreds of foods with poor nutritional value could receive the MHS, mini health surcharge. Trillions could be raised to pay for health care for everyone. Contrary to popular thought, healthy food in general is not more expensive than unhealthy food. I studied it. I do not agree that healthy food is more expensive. My best friend, Dr. John Crawford, whose wife is a dietitian, agree with me 100%. This is the food industry making believe that healthy food is more expensive. I don't agree with that at all. In summary, I think I've presented a way of covering everyone in something that already exists. It's something that's doable. I figured out a way how to pay for it. We'd be healthier for it. It would not break our government. We'd be healthier. We'd all be covered by health insurance. I think this is a wonderful plan. I hope you help me bring this to the Congress. It would help all of us. Thank you so much for listening to my ideas. And if you have any to add to it, feel free to email me at rudycashman at Yahoo. Thanks very much.